Welcome to Parent Squad, and it is that time of year when we fall back our clocks and it starts getting dark earlier and earlier. Add to that, you've got the cold, and that change from warmth and sunny days to kind of chilly, dreary ones, it really can be tough. So here to help us navigate it all is Franciscan Health Family Dr. Matthew Lash. Dr. Lash, thanks for being here because this is an important topic. I feel like I have certainly felt it. They sometimes call it seasonal depression. I'm sure you can give us more information. So we've heard the term SAD or seasonal affective disorder. Let's talk a little bit more about it and how it could be different from depression. So what's all the differences in that?
So seasonal affective disorder is kind of a disorder that we've kind of found kind of watching people's moods over some time. Essentially, as you see less light, essentially you develop, essentially a sad mood, maybe a little bit of change in appetite, maybe some other symptoms. Mm-hmm.
When you say change in appetite, are you thinking eating more or eating less? Because we typically eat more because we're inside. There's less to do, mm-hmm. In terms of being outside versus inside. And then the holidays, once those hit, everyone's eating.
So it's eating more. Yeah.
Okay.
Yeah. So, and that's kind of different from depression.
Okay.
Because depression, typically you could eat more or less, but typically you're having it affect other areas of your life, right? So your interactions at work or your interactions at like your energy level, like, your work performance, right? Other areas of your life start to suffer more than just eating and feeling a little bit tired.
Okay. So the holidays are supposed to be a time of joy. We know that's not always true. How can this time of year contribute to both depression and seasonal affective disorder?
Yeah, so, a lot of times, and kind of bringing in a little bit of a discussion of like bereavement is, a lot of people unfortunately lose people during the winter and holiday season, right? Yeah. So, why can that, how can it bring out SAD, right? It's the light level, right? So decreased light level makes us, changes our mood, right? Having lost somebody, right? That can definitely affect your mood if it, especially if it happened around this same time, this year,
or
last
just
year.
Going through the holidays without that loved one.
Exactly. Yeah. So, and kind of the difference with bereavement is, if it's just bereavement and not depression, then typically it's all kind of related back to that person. Like, I don't want to go see Santa because I had lost somebody and I remember I used to go see Santa, or I don't want to go to the mall because I would remember spending time with my mom at the mall.
So you would say that that's more bereavement than it is depression.
Yeah.
So the issue with, when you start talking about grief too now, is that it really does come in waves. It's not a consistent journey. And so you might have been fine last holiday season, last Christmas, you made it through, and this Christmas may not be going very well.
Exactly, yeah. And I mean, with depression, it does come in waves too, but it tends to be more present than it's not, right?
Okay.
And a doctor can obviously help you figure that out. So, whether that's, a psychiatrist or your family medicine doctor, right, can help you figure out and kind of wade through that. Yeah. So, if somebody is concerned.
I was going to say, hopefully, if you have someone around that you talk to or that you haven't spoken to, hopefully they're able to kind of urge you to take some action and see a professional if it tends to get that way. Yeah. So let's actually talk about the symptoms for children. We know children are a lot more pliable, but clearly they are humans too. So what can, or maybe I should say durable. I was trying to say children recover very well from tough situations, better than adults do a lot of times. But if you're noticing some of these symptoms, then what would they look like?
Yeah, so and that can be really difficult because kids can have a lot of things that can change. So again, that's where definitely a medical professional getting involved. But for a kid that's going through depression, typically you're going to see a lot more anger, a lot more emotional outbursts, right? It's pretty rare below like in the toddler setting. But like once you get into adolescence, that's where you start seeing a huge pickup in that. In depression symptoms, so or overt depression. Okay. So obviously, acknowledging it, say, hey, I know this is happening. What do you think's going on? Talking to your child about that. They might not have some insight that obviously you as the parent would have, but obviously bringing it up, talking to them about their symptoms. And then I would say, hey, it doesn't hurt to ask about those, thoughts of hurting yourself or others. And that's kind of how I put it, right? So if they're having those, it's better to address those and deal with those sooner rather than later.
I don't want to gloss over that.
Yeah.
Are you supposed to just flat out ask the question? Like, do you think that you're that you would consider harming yourself? Do you think that you would consider doing something bad to yourself? You're just supposed to ask children that?
Yes, and I would make sure, again, when you're having those discussions, you shouldn't just be off the cuff like you're going out the door, right? You should make sure you have dedicated time to be able to talk to your child about this. Set away all your distractions, put your phone away, turn off the TV, maybe even do it while going for a walk. I know it's cold outside, but maybe a walk in a place that's a little bit more private, but going for a walk in a place where you can actually talk and spend time with your child.
And
right?
Parents should not be concerned about putting that idea
Correct.
in their head with
Yeah.
that question, because I think people are like afraid to bring that up. Like,
Exactly.
well, I don't want to, encourage them to do it. You should just ask
You should, yeah.
if you're concerned.
And making sure you're ready for the answers, right, that you get. Because if they say yes, what are you going to do about that, right?
Yes.
Are you ready to bring them to the emergency room right now? Are you ready to call your doctor's office and say, hey, can we get an appointment today?
Yes.
Right? If you don't have that mindset or that, you have to be ready for the answers you're not expecting.
Yes.
Right? So.
Yeah, that is the job of a parent. So, okay, if we are finding something that may not be that serious in ourselves or our child, there are some ways that you're saying we should brighten the mood.
Yes.
So let's start with light, you're saying.
Yeah, light therapy. Yeah, so
Okay.
Light therapy can really help for seasonal affective disorder. So it's that disorder where, hey, you just don't get enough light, right? We've seen studies, and it's pretty prevalent in northern latitudes and less
Okay.
prevalent in those southern latitudes, like Florida, right?
Right.
I know everyone's mood.
They're fine.
Everyone's mood gets a little better in Florida, right? When you
Yeah.
go on vacation. But yeah, so it's literally a box that you can put either at your workstation or right by your bed, that you can essentially, it replicates similar light that you would get. Again, you can use it with lights or, like overhead lights, but this one is, there's specially trained amount of light that they have
Okay.
of this special wavelengths that kind of help you with your mood, help you stay awake, especially if it's near the end of your shift or the beginning of your shift to kind of get you going.
Yeah,
So,
I've heard some people on our morning shift talk about using that,
Oh, yeah.
the light to kind of help trigger their brain and wake them up, or maybe open your blinds or try to get outside if you can.
Yep.
Okay, also stay connected. There are people that we should be reaching out to that kind of help make us a whole person.
Yep, and kind of how we developed our society and our morals and what we do. The holidays is a time where it's already dreary outside.
Yeah.
So we have a lot of those holidays. It's almost like we had put them there for a reason, right? To bring us together, whether that's Thanksgiving or Christmas or whatever, holiday that individuals celebrate. But in terms of, reaching out to individuals that, whether that's family that's been disconnected, right? That's a time to do it.
Yeah.
Right. Bringing them back into the fold, getting them engaged in the family, seeing how they're doing, checking on your loved ones that, might be by themselves.
Yeah, I got to say, some of this can be tough, doctor. There's so much going on in the world.
Yep.
And not everybody is, copacetic, is at peace with their family members right
Exactly.
now.
Yep.
Yeah.
I know, and that can be hard, right? So, if families are in disagreement, there are professionals, depending on if it's your spouse or if it's your parents, right? They have different counselors for different things.
Yeah. What if they're the problem?
Yeah.
It's not me, doctor.
I know, right? And
They're
that
the
could be
problem.
hard. That could be
Yeah.
hard, right? Especially when.
But it's real.
Yeah.
I'm joking. I'm
Yeah.
chuckling. But I mean,
Yeah.
we all have the family.
Yeah, and that's hard because it's your family and you love them, right?
Yes.
So when it is somebody that's elder than you, right? You have to think, are they going to change, or are you right?
Yeah.
Or are you going to be the one that's going to help mend this relationship?
And then
right?
setting realistic expectations, because sometimes you end up just loving people from afar.
Exactly. Yep.
Yeah,
So
that could be tough sometimes.
not trying to change them, or exactly.
Yeah, but they need to change. They're the problem. All right. Also, practicing gratitude. Like we said, loving that person from afar. Maybe it's just appreciating the time that you did have, or even just in general, practicing gratitude. I know we're all going into the holidays with some pinched budgets when we're looking at food costs and other things, but
Yeah.
to be able to appreciate what is in front of us.
Yeah, and that can be very helpful because, just thanking somebody or having that gratitude mindset can really help break even some types of depression. Just giving back to other people, whether that's at a food bank. I know, people might be struggling with food. But giving of yourself to other people, it's kind of weird because it's like, am I giving myself away?
Sometimes you feel like you don't have anything to give,
Yeah.
but you're saying if you can muster up that energy, that maybe you'll get something back.
Exactly. You almost get more than you give out.
Yeah, I've experienced that. I can totally see that. I would highly recommend. Also maintaining healthy habits. What do you think, what comes to mind when you hear that?
So exercising regularly, eating healthy, right? I know, it's the holiday time,
Right.
so like
Good luck.
everyone binges out. But getting time to exercise regularly, whether that's at your house, at a gym, or just going for walks, right? Getting regular time to exercise can help improve your mood. So those are some healthy habits. Putting away phones, disconnecting yourself a little bit from media, because media can be all-encompassing.
I do understand. One thing I also see is a lot of people who they had children, and for whatever reason their children might be around. Maybe their children is with the other side of the family, or travel is just too much. And so you don't have those same traditions and experiences that you created, but maybe now's the time to create new traditions. And
Correct.
sometimes it might be a tradition with yourself.
Exactly, yep. So, kind of embracing either, your religious tradition, whatever that was, can really help. I like to think of people as whole people, from, their exercise, their medications, to what they eat, to also their spiritual life. So, reconnecting with those traditions, or creating new traditions, whether that's, hey, I'm going to go and spend time with my friends, right? If you're not connected with family. And we're going to do, go to some place in, close by, do a Christmas ride, a train ride with Santa, or go ice skating, right? Setting up those new traditions, right?
Yeah, I love that. Dr. Lash, you're so good and you're so easy to talk to.
Well, thank you.
Is this something, so when you have your patients come in, that you discuss with them, or if you notice something about them? I imagine, though, you would get a lot of patients, obviously you would want to direct them to the right professional, but then they would say, oh, no, I don't need to see the therapist or another doctor, or what would you say to those patients?
Yeah, so, and I get that all the time, right?
Yeah.
So of like, hey, I don't want to see a therapist, right? Therapy can be very helpful and effective in treating depression or other symptoms. Right? So I would just say, don't be afraid to engage with it. So again, you can always try out a therapist. If you don't like them, you can switch to another therapist. If you don't like them, switch to another one. If we've tried a couple and you're just not liking anyone, again, it could just be medications alone, or just following up with me as the provider, and I could see you frequently. So
that's nice. It's good. Clearly he's doing his job, doing a great job, because you're able to recognize just some of the other signals, and you're talking about the health of an entire person, a whole person, not just physical health. Thank you, Dr. Lash.
Well, thank you for having me.
Appreciate it. We have more at WTHR.com/Parent Squad, and still ahead, how to handle the question every parent will get at one time or another. Can we get a dog? The City Moms is here with ways to decide if a pet is right for your family.